Joint and muscle pain are complaints that many of my patients suffer from on a daily basis. It's important that I find the real source of their symptoms so that I can make the proper diagnosis and prescribe the right treatment. X-rays, CAT scans, and MRIs have been for the longest time the tests I use to come up with the correct diagnosis. Recent advances in sonar and ultrasound technology have created a more functional and practical approach to evaluate joints, muscles, ligaments, and even nerves. This technology is called musculoskeletal ultrasound.
After I'd been typing for quite a while, I noticed a pain in my elbow. I was unable to open a jar, for instance, or a can, and I was unable to drive. This made me feel very frustrated.
As a personal trainer, I've always taken good care of my body. I knew, however, that I had some arthritis in my knee, but never expected to have such a hard time going up and down the stairs. Pain medication did the trick for a few days, but I started worrying when the pain would wake me up at night. How could I find out what was really going on with me?
Clinical evidence and research supports using ultrasound as the first diagnostic test for numerous musculoskeletal conditions. Diagnostic ultrasound offers a number of important advantages compared to X-ray, CT scan, and MRI in terms of safety and effectiveness. Musculoskeletal ultrasound simply uses sonic waves, and there is no exposure to radiation. At the same time, diagnostic ultrasound is non-invasive and offers real-time imaging, allowing for examinations of structures at rest and in motion. This ability to capture the movement of musculoskeletal components differentiates it from other imaging modalities and can permit more accurate diagnosis.
I was glad it was tendonitis in my elbow. And I knew after those years on the computer it would eventually catch up with me. My doctor sent me for a diagnostic ultrasound and started me on a program of physical therapy and exercise. This really works.
The doctor explained that the pain behind my knee was the result of a cyst filled with fluid. My doctor used the ultrasound machine to safely remove the fluid, and I have no more pain.
For a variety of reasons, healthcare providers have gravitated toward more expensive imaging modalities over time. Use of such imaging modalities as CT and MRI instead of lower-cost alternatives, such as ultrasound, may not ensure better outcomes, and it also increases the cost to the healthcare system and the cost to your patient. In 2009 alone, CT and MRI accounted for 95% of Medicare-allowed charges for all extremity imaging. Only 5% was for ultrasound, which is cost-effective and avoids the inherent risk of radiation exposure. Using a lower cost and a safer approach to imaging would make clinical sense for many conditions without compromising care. An article by Parker et al., published in 2008, indicates that the substitution of musculoskeletal ultrasound for musculoskeletal MRI, when appropriate, would lead to savings to Medicare of more than $6.9 billion in the period from 2006 to 2020.
I use musculoskeletal ultrasound not only as a diagnostic tool, but also to provide safe and precise injections. This tool makes a huge difference in the effectiveness of my patient's care.
These are but a few of the cases where the astute physician, through their concern, learning, and experience, can guide the patient in the right direction toward a correct, timely diagnosis and start the right treatment plan. Ultrasound is an easy, reliable, and safe test.
The test was as easy as taking a picture, but best of all, everything was thoroughly explained to me about the test.
My doctor was able to come up with the real solution to my problem because of the imaging he had from my ultrasound test.
Ultrasound has opened up a new dimension in my practice. There are many instances when I cannot tell whether the swelling is a cyst or it's a solid tumor, and ultrasound can instantly give me the answer. The ultrasound machines have become very small now. They're very portable. When I have a problem in my office, Dr. Kostopoulos can bring the ultrasound machine to the office, to the examining room, and instantly solve a problem.
Musculoskeletal ultrasound has changed the way I practice medicine. I can now have a greater certainty for my diagnosis, and I can manage my patients more effectively. My patients are happy, I'm happy. This service has significantly enhanced my practice in all aspects.
We believe in a team approach. Our team of trained professionals, always in the closest of cooperation and communication with your practice, is here to provide your patients with a pleasant and comfortable experience and to obtain the valuable information needed by you to accurately diagnose and properly treat your patients. Proper testing assists in correct diagnosis that leads to appropriate treatment. Musculoskeletal ultrasound testing can be part of your medical practice now.